Hey, what are the best medications after you had your first heart attack? We'll go into the strategy and in the checklist on this video about what you should be taking after you've had your first heart attack or stroke, or what we call your first cardiovascular event. This video will also go over the same recommendations that you would implement if you have known coronary artery disease, even if you didn't have that acute heart attack or stroke. Let's get started. Number one, the overall strategy when we're dealing with cardiovascular disease. Remember, cardiovascular disease is the #1 killer here in America. And so if you had your first event, you made it through, we need to reduce your risk factors. And so the overall strategy is what we call reducing your modifiable risk factors. And the top ones are gonna be number one, do you have any bad habits that is directly correlated to increasing your risk of your next event, such as nicotine, smoking, number one. So get rid of that habit. Number two, are you taking any street stuff that could hurt you? So one of those would be like cocaine or methamphetamine. Definitely got to cut those. That's a hard stop, must stop kind of thing. And I would avoid just certain things that have ephedra-like properties in them. Caffeine, controversial on whether or not that really increases your heart attack risk or not. Then comes the traditional modifiable risk factors, such as controlling your blood pressure, normalizing your A1C, or getting rid of the diabetes, and then treating the cholesterol. Those would be your modifiable risk factors. But I want to get more specific about, here's a quick checklist on the tactical level that you could bring your team. Number one, nutrition in general, whole food, plant-based. That would include the Mediterranean diet. Also, that actually it does have some data about reducing cardiovascular risk, but let's reduce the processed foods, reduce the four-legged creatures, the dead cow, the dead piggies. And so that way you don't increase the inflammation in your system, because the inflammation in your system is what leads to that acute plaque rupture. Let's talk about exercise, get the cardio in that has the data for reducing your risk. Does resistance training reduce your risk for heart disease or having a heart attack or stroke? There was one study, about 13,000 people were involved in it, and lifting one time per week, 1 day a week basically, reduce your cardiovascular risk. That is a pretty cool study. So add lifting as part of your checklist of things to improve on if you had your first heart attack. I like people to lift weights on a regular basis to help your weight under control, which leads to the next one is weight reduction. Let's reduce your weight about 5 to 10% as a minimum to help reduce your cardiovascular risk, because if you reduce your weight, your blood pressure gets easier to control, diabetes gets easier to control, your cholesterol usually goes down. Okay, let's get into actual medications. Think of this as part of your checklist too. You got to be on an aspirin, whether or not you're on a platelet inhibitor like Plavix or clopidogrel or one of the cousins. I will leave that up between you and your cardiologist to decide that, and your bleeding risk. Then comes your LDL reduction. So if you had an event, we want to drive down that LDL as much as possible. I know there's a lot of controversy about dementia and all that with someone who had an event. If I had my first heart attack, I would be pursuing the lowest LDL possible to reverse any plaques. And those medications, I would put my people on Crestor. Let's frame this that there's not a cost involved. So branded Crestor, branded Zetia, and then a PCSK9 inhibitor. One of them is called Repatha. And those have been all shown to reduce your risk for the next event, to shrink down that LDL and help reduce that plaque burden, those soft plaques that are in the artery. The next best medication for your health if you've had your first heart attack and stroke is gonna be a GLP-1 receptor agonist. Those like your Ozempic and your Mounjaro. These are traditionally used for diabetes. They're also used for weight loss and weight control. They're branded as Zepbound and also as Wegovy. Now look, you should be on one of these medications if you've had that heart attack or stroke, or if you have known coronary artery disease, because they've been proven to reduce the risk of your next event. In addition, a nice side note too is a reduced 10 out of 14 obesity associated cancers. Pretty cool. Now the next one after that is your serum glucose transporter 2 inhibitors. Not only are these great medications to treat diabetes, heart failure, and chronic kidney disease, they are also cardiovascular event reducers. They reduce your chances of having a heart attack and stroke. So get on that Farxiga, get on that Jardiance, but you gotta know how to manage it. Your team has to know how to manage it. If you're undercarbing and so forth, I have other videos about that, but this is a quick checklist of if I had the first heart attack, if I had my first heart attack, this is what I would put myself on. If you're my patient, this is how I would be treating you. Now, the next thing is omega-3. So is there data about omega-3, specifically EPA? Absolutely, there's data. Visipa did it. The makers of Visipa, they have the data. Then you would be on branded Visipa in my book. So ask your physician team, ask your medical team about putting you on Visipa. Number 2, if you can't get Visipa because of cost issues, then I would go with a generic prescribed EPA. Number 3, the next best option after that would be a purified over-the-counter actual fish oil. Visipa and generic Visipa are actually made in the lab. They're not from fish oil. They are a prescribed or created EPA omega-3, but you can always get fish oil that claims to be purified. It's one of those that they didn't do the studies, so we don't know what you're really getting. The next thing is, the last one is, there's some good data coming out. They keep restudying metformin, and they're showing some benefit with that. So I probably would put you on metformin once I got you through the first 9 things, and then I'd be adding number 10. Other specialties that could handle these multiple medications and the complexity of a patient who's had their first heart attack and stroke also include endocrinologists, internal medicine, a family medicine physician. Usually you will need to find an obesity medicine physician and internal medicine physician to manage not just the weight, but also all the other diseases associated with that first heart attack or stroke. Balancing all these medications is something that you need a trained professional to do that. Most of the time, it's not going to be your cardiologist. They're going to recommend it, but they don't deal with the interactions of all these different medications. How do you balance the Jardiance with exercise, with a GLP-1 on board, that we don't starve that patient down and we have a poor outcome from that? But you need someone who's trained in that, and that's usually going to be an obesity medicine trained physician. I am an internal medicine and obesity medicine physician in North Texas. Think of this as a checklist. I'll leave a copy of this in the show notes that you can click, bring it to your practice. And of course, like anything else, don't start any interventions unless you have professional advice. These are the things that you should be doing or stop doing, and these are the medications that you should be on if you want to reduce your risk for your next cardiovascular event. I'll see you at the next video.